Wow, what an incredible 2 days this has been. This year's brought so much uncertainty, unrest, and anxiety along with it. And we know that the conversations we've had over the last 2 days need to continue. At MHA, we're committed to continuing this work. As students and teachers return to school in such uncertain times, we will continue to offer them our unique resources to help ease their mental health burdens. And we'll continue to call on policymakers to make school children a priority, to fund mental health resources and education for all students, teachers, staff, and parents, and to fully fund the special education mandate that entitles every student, including the tens of thousands with early stage mental illnesses, to the individualized services they need to succeed academically. The pandemic is not an excuse not to do this. These are essential parts of public and private education. And as employers and workers continue to adjust to more remote work than ever before, and as all forward-thinking employers work to hone in on building productivity by supporting the mental health needs of their employees, we're going to be right there with you. Honoring those who step up with our Bell Seal for workplace mental health, and providing guidance, support, and connections to resources to those who want to step up and ask for our help. To the broad community of those aiming for mental health and wanting to mitigate the effects of mental illnesses, we will continue to address your needs. All you need to do is ask. We will continue to offer our free online mental health screenings at MHAScreening.org, which is by far the largest and most comprehensive real-time mental health screening program in the world. We have called attention to the hundreds of thousands of people who are newly affected by anxiety, depression, psychosis, and other conditions since the beginning of the pandemic, and the tens of thousands who think regularly of suicide or self-harm, and to literally millions more. If you or your loved ones are among them, know this: we and our MHA affiliates around the country are here for you. We will do all we can for you. We will offer you resources, information, peer engagement, and tools you can use by yourself or with others to monitor and improve your mental health. And we will work non-judgmentally with you as you decide what help to seek and when to seek it. It's all there at MHAScreening.org and our S2S Screening to Supports post-screening environment. All it takes is a tap on your tablet or phone or a click of your mouse to give you some hope. And to push policy forward, we will continue to report out just the aggregated data of what we're seeing from our nearly 6 million screeners to date. This is helping us quantify the impact of mental health concerns on every population and subpopulation. The mental health impacts of the pandemic specifically, especially among young people aged 11 to 24, who are feeling these effects most deeply, and the information we need to advocate for changing the present systems of care, services, and supports that have primarily been responsive to the needs of the few at the expense of all others. This should go without saying, but it can't. We have suffered for centuries from a segregated mental health system. Every other condition got care in the regular health system, informed by public health. And we were segregated into primarily a state-run mental health system informed by public safety. Many of you have heard me say this many times before. By applying a non-clinical danger to self or other standard as a trigger to treatment, we made mental illnesses the only chronic diseases in America that we wait until stage 4 to treat, and then often only through incarceration. We have called this stigmatizing, discriminatory, inhumane, as it has ripped apart families, undermined our sense of community, and cast allies as adversaries, as we have tried repeatedly to change this for more than a century. And what has crystallized in the past few months perhaps as a result of the enormous stress we have experienced as a result of the pandemic, and perhaps coupled with generations of trauma to which many people have been subjected, it doesn't really matter, is that we haven't just done this as a matter of policy to people with mental health conditions. We have done this as a matter of policy to Black people, brown people, all people of color, biracial immigrants, people whose first language was a language foreign to us. And by doing this, we have undermined the mental health of our nation so that today, according to the CDC, a quarter of the nation is thinking about suicide. And today, according to the US Census Bureau, a third of the nation is experiencing anxiety and depression. Our founder, Clifford Beer, said that we must fight in the open. It is incumbent on us to say some things in the open, to build bridges that will enable us to take this fight successfully to the ballot box this fall, into the 2021 Congress, and into the next 4 years of what we all must work together to assure will be a more enlightened administration around mental health. The first is that race matters. It always has. Ending racism is a mental health imperative. The second is that MHA is committed to anti-racism in all that we do. This means that we pledge to work against individual racism, interpersonal racism, and institutional racism in all forms. The third is that ultimately it is about policy. We will not forget that racist policies lead to racist ideas. Discriminatory policies lead to segregation in practice. And the solutions involve changing policies together if we ever want to successfully change practices and ideas. Black lives matter. When we talk about mental health, don't all lives matter, some have asked us? Of course they do. That's why Black lives matter. It's simple. It is because a young Black man with a mental health issue is going to be treated differently from a young white man, a Black woman differently from a white woman. They have always been in our part of the world since 1619. A Black man will be expelled from school more frequently, incarcerated more often, homeless more commonly, unemployed more quickly, the target of police violence more likely, and left behind more simply. I don't just believe this. In my family, as in millions of others, we have experienced this. At MHA, we will keep talking about these things. We will also act to create lasting change. We will stand with others who are raising their voices and acting to ensure equity across systems. We will continue to be part of protecting human services, the right to assemble, to protest injustice, and to fight racism and to end it once and for all. The reason for all of this is also simple. What all of us need more than anything else, all of us these days, is hope. Hope that the pandemic will abate. Hope that, like Senators Cassidy and Kaine, our leaders will lead, caring more about us than about themselves. Hope that our lives will get back to normal soon, or at least that everyone will find more comfort and joy and experience less trauma and stress as we move forward. Hope that we will become one people someday, all truly treated equally. Hope breeds resilience, and resiliency is the ticket to recovery. And that's why, if you've enjoyed the programming of the last 2 days and you want to keep talking about these issues with us and working on these issues with us, you will not want to miss next year's annual conference, scheduled for June 10th to 12th, 2021 in Washington, D.C., with the theme, From Resiliency to Recovery. We certainly hope that by then we will be able to gather together safely in person. You can sign up for updates on the event and all of MHA's programs at mhanational.org. Thank you to all of the sponsors, and thank you to all of the speakers that joined us during this week. And thank you to all of you for tuning in. Be well, take care, and stay safe.